I was talking to a patient, and the patient was asking me why she was being healed, why she was seeing results, why she was seeing regression of the stage 4 cancer, yet others around her had not. In fact, others around her had passed away because of their fight. Why she was told by her oncologist that there was no hope, there was no cure, yet she was seeing results. So the question was, why me? And I think that's a good question. When you look at cancer, there's probably no word that's more feared, that creates more fear than the word cancer. So when a patient is sitting in a doctor's office and the patient is told they have cancer, immediately fear is a result. It's a natural response. It's like the apple falling from the tree. Gravity takes over. The word cancer in a diagnosis, fear takes over. Oncology, especially conventional oncology, doesn't do anything to counter that. The purpose of a physician is to give hope. So when we look at the diagnosis of cancer, we know it's dominated by fear. Our job as a physician is to give patients hope. The Hippocratic Oath doesn't provide delineation about who gets hope. It doesn't say, well, if you're a type 2 diabetic, you can get hope, but type 1 diabetes, you can't. Or stage 1, stage 2 cancer, you can have hope, but stage 4, you cannot. Pancreatic cancer, you cannot, but stage 2 breast cancer, you can have hope. See, being a physician means you focus on giving every patient hope. You be real, you be honest, but you give hope. The word hope literally means confidence in a tomorrow. It doesn't define what that tomorrow looks like. But what our job as a physician is, in giving hope, is to help build out what that tomorrow looks like. And then out of that, build the confidence in it. Because if we as physicians do not give patients hope, we undermine them, we propagate the fear, and that in turn leads to despair. When a patient has no hope, a patient can't dream, a patient can't see a tomorrow, a patient can't see a future. And so in that, there's no reason to move on. So in essence, being a physician, to focus on healing and wellness in the dire situation of what cancer can be, it is imperative, it is essential that hope be the first thing that's presented. Foundationally is what's presented, but it's presented in the reality of the context of what faces the individual. It says hope that there's a tomorrow, but let's build that tomorrow out. And then let's build that tomorrow out to a week, to a month, to a year, to 5 years, and beyond. Hippocrates was quoted as saying, "Physician, heal thyself." I think more appropriately it should be, "Physician, teach the patients to heal thyself." But let me add something in between there. "Physician, give hope to the patients so that they can heal thyself." So back to that patient. Patient saying, "Why me?" when others cannot say that, because that patient is going to pass the baton. That patient's going to pass the baton of hope. So just in a whim, I said, well, it's because you've been selected to hope it forward. It reminds me of that fast food restaurant, Chick-fil-A, that they paid it forward and it became a movement. What if we hoped it forward in cancer? What if we changed the way people approach cancer? What if we changed the way oncology approached cancer, and we approached it from one of hope rather than one of fear, one of healing rather than one of destruction, one of wellness rather than one of disease? So to that patient, I said, hope it forward. Her eyes lit up. So I knew at that moment that it connected with her, that hope is something foundational to her, and that she recognized clearly that now she had a task to not build the hope within her, but to pass that hope on to others. Others in the same situation. Maybe not the exact situation, but others in the situation of cancer, where fear dominates, where fear tends to control. But hope over fear should be our focus. And only through that can we hope it forward. So those of you that have been blessed with healing in whatever stage cancer, that is a blessing to you. But understand that because of that, hope it forward.